Welcome. Today we are tackling the rival every modern physician faces, Dr. Google. We have all been there, 3 a.m., 2 a.m., a slight headache, a slight sneeze, and 3 clicks later, Google is already convincing us that we are a medical miracle in all wrong ways. Joining me is someone who actually went to the medical school, and Google merely picks some of his works and presents it back to us. The eminent Dr. Pandiyan Natarajan. Doctor, welcome to the show.
Vanakkam. Thank you for having me here.
Screens glow and a steady hand, parsing data or a patient's story. Digital whispers versus the chest's hum, the search bar and the stethoscope.
Welcome. Today we are tackling the rival every modern physician faces, Dr. Google. We have all been there, 3 a.m., 2 a.m., a slight headache, a slight sneeze, and 3 clicks later, Google is already convincing us that we are a medical miracle in all wrong ways. Joining me is someone who actually went to the medical school, and Google merely picks some of his works and presents it back to us. The eminent Dr. Pandiyan Natarajan. Doctor, welcome to the show.
Vanakkam. Thank you for having me here.
Excellent. Doctor, we want to get straight to the most pressing questions that we believe the society wants to ask to you about usage of Google, wants to assess whether we as common public are really a hindrance to your profession, or are we really getting better than you? Doctor, they say the most common medical degree in today's world without a NEET or an MCAT is the Bachelor of Google, which Google is all of us. All be there, a small our elbow, and then we begin to search it. And 2 pages later, we're all thinking whether we should start writing our will. Doctor, do you ever feel that there's an invisible intern in the form of Google who is sitting and constantly prompting everything into your patient's ears, which otherwise you should be really guiding them all into? What do you think about it?
Well, that's an excellent question. But let me just ask you a return question. In healthcare, who do you think is the most important person?
The patient.
It's wonderful. That's what we all feel. That's what we all should feel. The most important person in healthcare services is patient. How could we be worried about an informed patient? Of course, misinformation is there everywhere. There is misinformation in every field. Isn't it so? When there's misinformation in every field, you don't expect a patient not to be misinformed. But a patient coming with any information is not your enemy, not your adversary. So I feel either Google or any search engine, or for that Google's, whatever you want to call it, son or daughter or progeny, the AIs, they are not your enemy either. A well-informed patient, if even wrongly informed, you get over that wrong information, give them the correct information, and guide them how to go about searching the net about their own condition. Let's say, for example, we diagnose somebody as infertility, and we find out what is the cause of infertility. We tell them, this is the cause for the infertility, and if you want to know more about it, you can ask me. But if you go home and think suddenly of something, please search proper websites. There are a lot of official proper websites, which by reading, they will get the correct information. If they don't get the correct information, they're going to be misguided and they're going to be worried. They may think, as you rightly said, should I start writing a will? Or they may think that with infertility, I have been guaranteeing 100% success rate. No, it doesn't, both doesn't work out. No disease is so desperate that you should think of writing a will, nor is it so easy that you can get over it easily. Everything requires attention, concentration, and AI is not going to cure you. AI will give you a lot of options, Therefore, I think Google is not a threat to us. Google is not whispering in the ears of the patient saying that, look, you've got a terminal illness. And we all went through it. As a medical student, when you are doing medicine, we used to hear this story. And we used to hear that all of us used to do self-diagnosis. Or if not, my friend who's as ignorant as me will diagnose saying that, look, you have a headache, please rule out intracranial tumor. And we got over it. None of us were burdened by it. So I think patients will get over it. And soon Google will not be an impediment. It will be only aid in improving patient care.
This is so much reassuring, and you're just making the patient so inclusive and giving that comfort that, yes, we can definitely Google and come to you, doctor. But that takes me to another question. That is this old adage which says that a little knowledge is a very dangerous thing, isn't it? Now, in your clinic, is Google a helpful assistant or is it a disruptive intruder? Can you give some examples that you have sensed on both these extremes that I just mentioned, as a helpful assistant and also as a disruptive intruder?
I don't think Google is an impediment at all. And as I told you before, an informed patient is an asset to patient care. We just imagine patients do come with a lot of information. They in fact come with a big sheet of paper with a lot of questions. I tell them straight away, give it to me instead of you reading it. Let me read them and answer them one by one. That's what exactly I do in my clinic. I see the questions and answer them at least to my satisfaction and their satisfaction at that moment. And therefore, I think any amount of knowledge, if it's wrong, we tell them, look, supposing they come with the information that IVF is always successful, or they come with the idea you can have a baby of desired sex with IVF. These are all wrong information. I've had patients coming. He said, no, not with IVF. Number one, first of all, IVF, you do not know, or ICSI, you do not know which sperm is going inside. That decides what is going to be the baby. On top of that, choosing the sex of the baby is banned in this country, in India. Therefore, we educate the patient, look, you can't choose the sex of the baby. One by IVF, technique is not there. There are other techniques which can do it, but that's not allowed in this country. So please be informed that you can't have a boy baby or a girl baby by doing IVF. So I think it is important they come with information. Sometimes it's misinformation. As far as knowledge is concerned, well, where is adequate knowledge? Half knowledge is dangerous is a nice proverb to say. But do you think anybody has full knowledge? After 50 years in my field, in obstetrics and gynecology, this is my 51st year, and 45 years in full-time infertility, I still think there is so much more for me to know. To give a simple example, the smallest cell in the body is the spermatozoon. We don't know enough about the spermatozoon. Mind you, the smallest cell in the body. This is despite the fact I read, keep reading, and still we do not know how does that single sperm get into the egg. Is the egg choosing the sperm? Or the sperms among themselves decide this would go inside? Is it a random occurrence? We still do not know. This is several hundred years of the research. So knowledge is always inadequate. If somebody thinks that they know everything, they are wrongly guided or wrong information. Half knowledge is dangerous. All knowledge is going to be not even half, probably even less than that. So, as things stand today, all we can say is, as things stand today, as we have information, it is not possible to choose. People tried separating the sperm and it didn't work out at all. Therefore, I don't think any knowledge is useful if it's not a wrong knowledge. How do you know it's a wrong knowledge? Only by prevailing technique. And what is right today may become wrong tomorrow. And that is again happening in all the fields. Every field you find what we taught 20 years back is already obsolete. So I would not think that half knowledge is dangerous. There's going to be something, no. But self-diagnosis is dangerous. Self-diagnosis and then self-treatment is dangerous. More than diagnosis. Diagnosis. At the most, when you diagnose, you go to a doctor. Self-treatment is dangerous because you can learn many facets to a cause, to a condition. If somebody has got type 2 diabetes mellitus, there are many reasons for it. If somebody has got infertility, many reasons for it. You don't decide, I've got infertility and therefore I'll take a kashayam or do this and no. You go to a doctor. If you're in doubt, you're not happy with the doctor, go for a second opinion. Seeking a second opinion is not insulting the doctor. Any good doctor worth his salt would be happy if somebody seeks a second opinion. and come back to them, or even settle down with a new doctor. We want our patients to get the best possible care. I think I'm doing a good job, so I would have patients be happy to come to me. But if they choose to go to some other doctor, or they want to hear what they want to hear, they go to another doctor. It's up to them. There's no issue at all. So I don't think it's a problem. Half knowledge is a tricky thing to define. So that's not dangerous in my opinion. Half knowledge treatment is dangerous.
That's such a beautiful paradigm that is coming from 5 decades of experience, doctor. And in fact, your 5 decades worth of experience is far, far more than the birth of Google itself, Dr. Pandiyan. And that's such a profound statement that you just made, where you said knowledge can keep replacing itself, and there's nothing called as half-baked knowledge or something. Very nice. Thank you for that perspective, Dr. Pandiyan. That takes me to one more point, especially in the midnights, where I have woken up a lot of time with a minor ache, and then probably I'm just compelled to go ahead and do that search. And invariably, I get taken to pages which just says that if you're having a headache, probably if it's going to go all around your head, then you are facing maybe a brain tumor. Why is it always that Google, or probably let me ask you this way, why do you think the Google's algorithms are probably not keeping it simple? Rather, it just exposes the worst case possible scenarios to all the patients. And of course, that ties back to the previous question as well, which is making us all into that pool of half-baked knowledgeable people who are compelled to go for an immediate treatment also. Do you have an advice for Google on what they should alter on their algorithms?
I'm not sure Google is going to listen to my advice, but nevertheless, we'll try telling them what should happen. See, basically, Google, as I know, is a commercial venture. They basically want the advertisers to keep going up based on the number of hits they have, whatever it is. So I think they should be redesigned in such a way that it should be either in the alphabetical order of the importance of the professional societies. For example, if you're asking about a headache, it should be, if there is an International Headache Society, they should come on top. And if there are 2-3 societies, put them in the alphabetical order. It makes it as simple as that. They are professional bodies. They are less likely to be giving wrong information. They also can give sometimes wrong information, or the information can change. What was considered correct 10 years back, 20 years back, 100 years back may be wrong today. So, but they will revise. They keep revising. The guidelines of all the professional bodies are periodically redefined. They get revised again and again. Whereas other things are not going to do it. So that is where I think you going by the hit alone, that's not a good way of spreading information. And Google is such an important engine of search. So they think they should be taking this into cognizance and give importance to the professional societies. It could be American Medical Association, or it could be British Medical Association, anything. All professional bodies which have got membership and which have got reasonable standing in the community, they should be number one priority. Then the other things can come by number of hit lists. But then I hope they listen to it and they make amends so that you don't go by hit alone. That is what would be the best thing to do for Google and for the patient.
Excellent. I mean, such a scholarly advice that you just presented it back to Sundar Pichai and his team, Dr. Pandiyan, and that is such a nice one, of course, and that makes things more reliable and it gives more convenience and confidence back to people who are looking into it, even for a layman, especially when it is going to be coming from those royal societies and authorized bodies who can vouch for what they are committing as the right information. Thank you so much for putting that perspective, Dr. Pandiyan. Now, coming in terms of the self-diagnosis that you just told a couple of questions back, right? And self-diagnosis is okay, but self-treatment is where the real pain point is, right? Now, has there been a scenario where the self-diagnosis was kind of contradicting your diagnosis itself? Have you seen patients who are challenging you and asking the question, oh, I have made my diagnosis, which I'm convinced is better than what you as a doctor is even saying. Has it been a scenario like that, doctor?
Luckily, I think it is my age or my baldness or my gray hair or what it is, I don't know. Nobody has really challenged. They have a lot of questions. They'll come and ask, why can't I take this? Why can't I do this? Why can't I take an antioxidant? Why not I take the supplements? I tell them clearly. Beyond that, I don't think anybody has challenged saying that your diagnosis is wrong or what it is, or this is what Dr. Google says or Dr. AI says or what it is. Nobody has challenged yet. But they do come with a lot of questions, or sometimes it's tricky, a little bit embarrassing also. Sometimes it's a little tricky ethical issue also, saying that that doctor gave this, so and so gave this.
Yeah.
So you're saying no, not to take it. I said, if you continue treatment with me, I would recommend don't take this. That's not indicated, that's not required. But it's really up to you. The patient has the choice of deciding what they want to do. But I also go one step further and tell them, look, the American society or the British society or Indian society or whichever professional body says don't do it. So that is why it adds weight to your statement. And so otherwise they think it's my whims and fancy. I'm saying something, don't do it, are not necessary. So I reinforce it by quoting the professional bodies, saying that no professional body endorses this view. So it may be in practice, but it's not endorsed by the professional society. So do not recommend this kind of treatment. But the patients do question. And I'm glad, as I told you, you are a consumer. Though you don't want to break it down to such level, consumer has every right to challenge what is being sold to them. We are selling healthcare to you, though it is not as simple as a commercial transaction. Yet, at the end of the day, even the government hospital also, somebody else pays. It's your tax money. They may not charge you at the point of care, but it's still, you have every right to ask whether you're paying for it or not paying for it. You have every right to ask, why should I do it? When it comes to surgery particularly, don't just blindly accept. If it's surgery, ask again, is it mandatory? Do you think you can do without surgery? I can survive without surgery, or I can continue to be all right without surgery. Is surgery absolutely necessary, or is it possible to go without surgery? This is important. You don't have to, blindly accepting is not good for the patient or for the doctor. So it's important you question, you challenge also. I would not mind if patient comes and challenges me with evidence. They come with some other doctor's opinion. I try to reinforce my opinion, or I correct my opinion. I can be wrong. All human beings are fallible. So if that is so, then I go back and check up and say, yes, today things have changed. No, there's no more surgery. Surgery is not required. In fact, I'll give you an example. Once upon a time, when we were all students, for duodenal ulcer in the stomach or the duodenum, surgery was a common practice in 70s and early 80s. Today, nobody does surgery. It's only medical treatment, predominantly. So ideas change, practices change, evidence changes, new research comes up. So we need to keep changing constantly. And the patient challenging is not an offense at all, or it's not an affront to me. I would be happy if I'm proved wrong with evidence, not just by somebody's opinion now.
Fantastic, Doctor. That statement that you're just making is making me to reflect and say that doctors invariably are putting the patients at the core of what needs to be done, which probably Google might be missing. It might be an early statement. I have more questions for you, but still I'm compelled to reflect and call that out. Now, doctor, have you, or rather, will you be able to endorse somebody as a good Google user? Your patient, I'm talking about your patient, who comes to you, or the caregivers, and say that, hey, you're a good Google user, man. Have you been able to endorse somebody like that?
No, not anyone in particular, but I encourage patients to do search. I always tell them this is a diagnosis, this is what it is, this is what I'll give you a simple example. A condition called DNA fragmentation. I'm not sure whether you're familiar. This is not, they talk about DNA fragmentation. This is a very common topic today, popular topic. I don't recommend it at all. So a patient will come and tell me all the other doctors, or at least many doctors recommend it. What do you say? I said, all I'm saying is, look, you go back, do a Google search, look at the professional societies. If there's one professional society recommending this treatment, I will revisit my idea. If nobody is recommending, it's only the popular opinion, That's not enough for me to prescribe this kind of management. So being challenged, Google use should be more widespread. But only thing is, tell them to go to the proper site. Go to Google and look for, or you can go to the site and ask for specific professional societies. That's what I told you. If it's headache society or neurology society, not to the WhatsApp University or the common people who want to write about headache. That is what is important. So I really can't think of any one person as a good Google user, but I always encourage my patients to go back and learn about it, more about it, if not from me, at least from the Google. Or I would say web. I don't even say mention Google. I'd say you can go to web search. It could be any search engine.
Internet itself, that everything we call it as Google. But again, once more, I would want to acknowledge that you're keeping us also inclusive invariably, independent of our knowledge quotient or our anxiety with which we are going to reach out to you. That's so much reassuring. So, doctor, tell us this. We know about comorbid conditions. So many comorbid conditions which are organic in nature. I call it organic in nature for the fact that the body itself is creating it. Now, after reading Google and its search outputs, I've gone sleepless. And I want to call that as insomnia because of Googling. Well, I would have said your click for a different thing. Now I am kind of having one more condition which I really would have avoided by itself. But again, my little knowledge or my anxiety levels, or as you told, the popular opinion which drives my decision to bank on what I'm seeing on Google itself, is creating another condition for me, like an insomnia, as I just said to you. What do you think about it? I mean, can I call these as symptoms because of Googling? Should I tell the root cause is Googling, or is it because of something much more ingrained in myself, which I need to tell it as a root cause and treat that instead of me going onto the internet? What's your take on that?
Google is an additional tool for a person who's already an anxious person. It adds to the anxiety, no doubt at all. Previously, your exposure to information was limited. See, as a medical student, we had information only to go to the library. You can take a book. Journals reach late. They don't come immediately to India. We all had any number of diagnoses. I told you, from a headache. If it's headache, intracranial tumor, if it's stomach ache, it's stomach cancer or whatever. We went on. But we all survived. We all survived despite the fact that we are self-diagnosing. And therefore, the scope has become more now. Previously, it only medical students could do it. Others had little limited access. Today, all you need is in your palm of your hand. You can have your cell phone and virtually diagnose. But but to curb it is not going to help at all. That only leads to more paranoia. Best is to tell them, look, encourage it, go to the societies. Now, still, of course, you will have problems. That is why after your self-diagnosis, go to a doctor, you can't treat yourself. So go to a doctor and get your doubt cleared. Well, I'm not increasing the footfall to a doctor's clinic. No. If you're paranoid about it. But if you're not, you go to somebody else who's a little bit more informed. It could be your own friend, a little bit more informed. No, all headaches are not intracranial tumors. We all know that. So I don't think, but a person who's already anxious, anxious personality, an anxious personality would increase his anxiety by reading more, definitely. So to curb it is not going to, curb is going to make it worse. He will have even more imagination. So best is to encourage him. You have doubts about these are the possibilities. Yes, go ahead. What are the possibilities? You exclude. That's what you do in diagnosis. Somebody comes to the headache, we do what's called as differential diagnosis. Put all the 10 conditions or 20 conditions, exclude them one by one and say this is not this, and therefore it must be this. Then investigate and confirm. So the way we proceed is listen to the patient quietly, calmly, then examine the patient, come to a clinical diagnosis based on the history, and then investigate the patient and find out what are the cause for it. Some don't require all these steps at all. History and examination should be good enough. Some require investigation. So to curb the use, I think it's not going to help at all. It'll be counterproductive.
That's a wonderful way to look into it, Doctor. On a very personal note, let me share this one with you. When I'm going to be presented with a plethora of choices, I struggle. I don't know what I need to choose. But when I'm going to just be presented, let's take like when at home, when I'm going to be served just with idlis, I know that today I'm going to take idli and I'm very convinced about it. But when I go to a restaurant and there's going to be a menu card, I struggle what I need to choose. And I often find that kind of an analogy when I'm going to do this Google search, and especially when I'm going to be in pain, I really get more anxious. And I'm not sure that I can relate and say that everybody are under the same thought process as what I am, but I definitely find it very hard when there are going to be a lot of choices that is presented to me. Rather, I feel it easier, especially when I'm in pain. A prescription works because it is more directive rather than me really feeding myself with so much of information and then asking myself all those questions. I really need help. And that's where I just compelled to again and again think, is it really good for anybody to seek a direct help to the physician like the older times? Or do you think that we should still stop by and then we do all these information gathering, become more well-informed, and then like reach out to the physician? What do you think should be the first step though?
Yeah, there's nothing wrong about, as I told you before, I keep repeating it. Being informed is nothing wrong about it. Yeah, a doctor can inform you, of course, but the point is, all doctors, with rare exceptions, don't have enough time to explain to you all the details about your condition. Of course, they give you important information. They don't know it at all. But if you want more and more information, it may not be possible to give the information all the information required. Therefore, seeking out another source, like a reliable, that is what I keep emphasizing. Go to a reliable source. Go to a professional society, seek out the information. You're well informed, is not at all. And doctor is not going to be hurt about it at all. You get the information. Okay, you can go to the old-time practice, like go to the doctor. Yes, no doubt at all. But choose a doctor properly. You have to, what we call in Tirukkural, Theran Telivum, Telindan Kanna Ayyuravum, Thira Idumbai Tharum, which means you must choose your doctor properly. That's very, very important. Don't go by popularity. Don't go by gray hair. Don't go by baldness. If you can find out. Unfortunately, it's not easy. It's not easy to choose any good professional. We have to go only by word of mouth. These ratings don't mean anything at all because, that can be hyped unnecessarily. So word of mouth, ask 2-3 people. And even with all that, you still may have to seek a second opinion sometimes. So nothing wrong in going to a doctor and listening to him, implicitly obeying him. But I'm talking only about rare situations. Rare situations, supposing some doctor is recommending surgery for you. Then it's a major surgery.
Of course.
Then there's nothing wrong about seeking a second opinion from an independent person, totally independent person, because it's a commitment. It's a commitment you're making for yourself and your body. Therefore, nothing wrong about seeking a second opinion and going back to the same doctor again. If you go to second doctor also confirms the opinion. Nothing wrong in going to the third opinion. It may look like endless, no. But that's where I'm saying, if you're going for a second opinion, choose somebody who's of the same caliber or even higher. Better to be higher caliber in terms of experience and seniority. And then decide about it. And if 2 people or 3 people concur and say the same thing, then if there's a choice you have to make about going for, not to operate or to operate is your choice. But at the same time, having a second opinion is not wrong. And going by the old fashion of just going to the doctor, trusting doctor, nothing wrong, but it's a little tricky because doctors can also make mistakes sometimes. So that is where I feel that no harm in reading about it and going and asking a doctor for clarification.
That's such a humbling moment. That coming from such an eminent professional like you is giving us all moments where we should reflect on our knowledge quotient itself. Thank you for us pronouncing all of those with such a profound humility. My last question to you now is that what is that one truth about the human body that Google will never be able to explain? Tell us that secret.
The emotion. the emotion, emotions play a major role in your well-being. It can't judge a mood. It can ask some questions, but you may answer the questions just to satisfy, or you may not even reveal your full emotion in answering the question. So an AI will do a structured interview of you, but beyond that, it all depends on what you reveal to it. Therefore, no Google is going to judge your emotional situation at that time. And that makes a big difference. Beyond that, all other things, all routine things, the machines can take care of. But the emotion is something which it cannot judge. You can judge a person looking at their face, whereas a machine cannot so easily judge, and you can also hide. Therefore, that is something which they will come out only when you start talking to them one-to-one. Initially, there'll be a lot of cold feeling, particularly when you're coming to a new doctor. But over a period of time, they'll loosen out and come out with it, which is not possible with a machine. It's still, no matter how personal you feel, it's still a machine, and there is nobody behind that. And therefore, you feel that you're not really sharing your inner feelings. That is what I think Google will lack, or for that matter, any AI is going to lack.
Oh, that is fantastic, Doctor. In a period where we are all fearing if AI is going to eradicate and make us all extinct, that one statement and the secret that you just revealed, that a text can never replace an emotion, is going to be edge of the wall for sure. And that is giving us all confidence. And I must just have to say that I feel significantly better now. I might actually delete my search history and keep my sanity instead, and remind with those emotions and get myself reassured that I'm still a human and I can emote. I can still go ask for that help and not really stay and stick to those search outputs that come when I'm just doing whatever I am doing on Google. It's been a fascinating 30 minutes, Dr. Pandiyan. You have reminded us all that Google might have a billion pages of information, but you also reminded us that it doesn't have a stethoscope. It doesn't have a gut instinct, and it certainly doesn't have your years of experience. Thank you once again, Dr. Pandiyan, for joining.
Thank you very much.
It's been a pleasure.
Thank you.